Thanks everyone for joining. I think we'll get going. Just a reminder of our social media handles. Follow us, and if we are not following you, please let us know so that we can follow you as well. And for our agenda today, we have a member spotlight. One of our members from Bhutan will share with us today. And we have a special guest today. I know that in the past we've had a lot of discussions about UICC, and I just wanted today to have someone from UICC to share with us for the educational session. And for upcoming events, we have Lynch Syndrome Day coming up, and just a reminder about our health equity grant applications. And then we'll have a few minutes to have a Q&A and discussions around what's been presented today or any new ideas for collaboration amongst our members or with GCCA. Thank you guys for making the time to attend. I know it's awkward timing for most of us, but it's the fact that we are a global organization. I appreciate your time. Just a reminder, we have 111 member organizations globally in 56 countries. This is just a reminder to all of us to just go on our website, go on to the Find a Member, and just see where all our members are for opportunities for collaborations, and where you see that we are not making an impact, to let us know if there's an area that we need to reach out to, or members that we need to reach out to in certain areas. And then for upcoming events, just a reminder that on the 22nd of March, it's Lynch Syndrome Day. Did you know that 1 in 279 cancer patients are positive for Lynch syndrome, but sadly 95% of them don't know? As advocates in our different regions, it's important that we speak to our patients about knowing their family history and to help prevent future cancers. If any of you will be at the NCCN annual conference, please visit our booth. We will be at the Patient Advocacy Pavilion. Just come and say hi. Our team would love to meet you and to connect with you. The big reminder for me today is that our CRC Health Equity Grants applications are opening soon. On the 1st of April, the process will start. Health Equity Grants are our way of supporting the massive work that's happening around the world to alleviate the burden that is caused by CRC in our communities, and just to support the work done by our members in different regions. And having said that, on that note, I have one of our Health Equity Grant recipients to share with us. He is Mr. Kama Topger, and the Executive Director for Bhutan Cancer Society. They were awarded a grant to increase colorectal cancer awareness and provide screening to a community of Buddhist monks who are particularly vulnerable for CRC. At this point, I will ask Kama to please share with us the work that you have done.
Thank you so much for having me here. I've been, like I said, I've been away from my workstation, the capital city of Bhutan, which is Thimphu, for quite a long week. Right now, I thought our engagement is from our time, 6:45, which is 4 hours from now. Just now I completed one session at one of the regional hospital here in south of Bhutan, and in another 1 hour, I have one engagement with students, 700 students in one of the schools here. So my times are limited. So before I start, this is the project. When we applied for GCCA CRC Health Equity Grant, we proposed to have increase access to awareness on colorectal cancer and also promote screening on the colorectal cancer. So we were one of the lucky recipients in 2024. So everywhere we go, whatever we do, be it on social media, or any promotion, we always carried Global Colon Cancer Association's logo with us throughout our program and project. So before I go into the project, I think it is important for the participants to know about my humble country. Our country is known as Bhutan. It is a very tiny kingdom, kingdom nested, sandwiched between two giants, South India to the south and China to the north. You can see our area is just 38,394 square kilometer, very over less than 1 million population. And then we just transitioned from absolute monarchy to now constitutional democracy. So our king still is the head of the state, and then the head of the government is the prime minister. And then our culture is deeply rooted into strictly Buddhism. Buddhism. That's why my projects, the key target populations were the lay monks. And then we are popularly worldwide, we are known for our unique philosophy called cross-national happiness. It was coined by our great king, fourth great king. And then we emphasize happiness and well-being over economic growth. This is how we measure our development. So this is a brief introduction about my country. Now, colorectal cancer in Bhutan is, although it is not very concerning, but the issues are really rising. In last 2 years, we have seen more than 170 cases of colorectal cancer. And then by going by the population that we have, barely 800,000 people, to have 178 cases of colorectal cancer is very high. So lucky for us, we were able to engage with GCCA, and I believe it is for the first time we were able to conduct awareness on cover so many districts that we have, and then communities on raising on the awareness of colorectal cancer. So our initial engagement with the Global Colon Cancer Association was the observation of blue head bow tie CRC awareness. So when we received that stipend of 300 USD, we were able to engage our networks, young members who are spread across the university, and then that small event was a big eye-opening for our society. So it was so successful, very beautiful pictures. Although we didn't, going by the culture, we couldn't use the blue hat and bow tie, but we tried to go everything in blue by having ribbons and then our traditional attire in blue color. So we also received a certificate of appreciation from GCCA for that event. Then later, when the CRC Health Equity Grant was open, call for proposal was open, we applied, and then this is the picture of me and my staff holding that application, that confirmation we received from the GCCA. So we had it posted on our social media, tagged GCCA, and that's how we started. So in our project, we had 4 activities on that project. First one, we wanted to localize the content that is already developed by GCCA, the sign and symptoms, the treatment, the preventive measures, all this we wanted to localize in our Bhutanese culture, and then have the resources developed. Then our third activity was to carry out the conduct awareness on colorectal cancer in the monastic institution targeting the monks. And then, excuse me, the fourth one was to organize screening camps. So I have it flagged on red because we overlooked it, and then when we developed activity, I think we overlooked it because our country had not started the screening program for colorectal cancer yet. Because any screening program to be organized, there has to be a guideline, and there is no guideline developed for the screening right now. So that's why we had this activity flagged on red thing right now. Now, after implementing the activities, and these are some of the achievements. Firstly, we develop the content we have, and this is you can see this is the poster, and we have a poster as well as pamphlets for distribution, and then we printed a lot. And every time we go to the awareness campaign and visit one monastic body, so we make sure that the principle of that monastic body and then have that poster pasted on their one of the common library so that the monks can go through. Yeah. Then on that pamphlet, although we couldn't incorporate all the information shared available at the GCCA website and the resources. So we try to pick up the most layman term and then the one understandable by important for the monks. So the topic covered on that poster is what the colorectal cancer is and their risk factors, some common symptoms, then what are the diagnoses currently available in our country, and some of the preventive measures. Yeah. So for activity, sorry, I had this noted as activity 1. It is actually supposed to be activity 3. So under activity 3, we didn't have this many monks to be target beneficiary, but we were so lucky to have received a lot of support from the monastic body, and then we were able to cover. Now Bhutan is composed of 20 districts, small districts. It's like provinces. It's like provinces. So out of 20 provinces that we have, we were able to cover 7 provinces, engaging 14 communities, and then the target population we reached was 431 monks. And these are some of the photographs that from the awareness session. So every time we conducted awareness, we were always accompanied by one surgical oncologist or one of the board member who is oncologist, and then we made sure that the sessions awareness sessions are delivered by the expert themselves, so that the awareness on colorectal cancer is medically and clinically correct. So yeah, and then although we may not have been able to organize that screening camp, but due to our media presence, our presence on the social media, and repeated occurrence on the national media, it has come to the notice of the health ministry. So this is the current health minister of Bhutan. So last time during the World Cancer Day, the health minister, they have prioritized, and then they issued a notification to initiate screening programs for colorectal cancer from this year onwards. So this is all. This is the direct impact and immediate result that we have seen. So it is all because of the continuous and awareness that we have been conducting, one community after another, and social media presence, and then tagging Minister of Health. So it was indirect, advocacy for the government to do something on it. So actually, I was, when I was talking, communicating with Ramaswamy, I was preparing my presentation because I'm constantly on the move. So I had to rush back to my place from hospital and then get settled, and then couldn't complete my presentation. I wanted to present some of the challenges we faced during the project implementation, and some of the community recommendation and acknowledgement that we received from communities also. So I couldn't prepare my presentation more than this. So this is it from my side. So if there are any questions, so I'll be available. I still have half an hour for that program, so I will be there with you. Thank you so much for your attention.
Thank you so much for sharing, Kama. even if you don't have it on presentation, but are there some of the challenges that you think you'd want to share with us, that you've experienced,
Yeah,
that you can speak on now?
yeah. One of the biggest challenges was in our proposal we highlighted to advocate the ill effect of areca nut use. Areca nut use in Bhutan is very high, and then especially among the monks, the younger one pick the habit from the elder ones, and then we wanted to advocate on that. Although we did attempt, but it wasn't very successful because that areca nut is very culturally sensitive. It is part of the culture in Hmong body. Whenever someone go and visit high ranking monk, they go with uh, areca nut, and that all whole substance as an offering. So it was quite sensitive for us to speak against the areca nut, and then this was we couldn't do it openly, although we did mention indirectly that what the areca nut contains, what WHO's stand is on it. So we did do, but we couldn't do it as we anticipated during the project development.
Let's hope we'll change minds as time goes on, but thank you for the good work that you do and the impact that you have in your area. Thank you for sharing with us. We also are in March, guys, and Blue Hat Bow Tie Weekend from the 28th of March to the 31st of March. I hope all your events are coming together. We cannot wait to see your lovely pictures and videos. Please remember to share with us. I'm also very busy where I am planning and preparing. It's exciting times for us. I hope everyone is on board. And now to our main speaker today. We have Muriel with us. Muriel Otle is the head of membership development at UICC. And I know that we've spoken about UICC, and we had one of our members, Pancho, share in the past about the work that he has done with UICC. And I think we are lucky today that Muriel is with us to share. Muriel works with different stakeholders, uniting global stakeholders in cancer control, including societies, health ministries, research centers, patient groups, and foundations. She's here today. She'll share with us the benefits of becoming a member and all the wonderful work she does to help member organizations. Thank you, Miriam.
Pleasure to meet you all, and it's such a great start of a presentation to hear Karma presenting his work, because Karma is also quite active, has been quite active with UICC, specifically on our regional work. So nice to see you again, Karma, as well. I have a few slides prepared for today. There's quite a few, so I'll try to run through them briefly so that we have a bit of time for Q&A. But as Tumi said, I oversee the membership engagement work. We are also quite a broad network, such as GCCA, although we cover all types of cancer control stakeholders, and also have a presence in 170 countries and territories. Yes, so as we said, we do have quite a broad network, not only of members, but also of partners. We're based here in Geneva, Switzerland, also because of our official relations with the World Health Organization and different UN agencies, with the United Nations. In terms of partners, these are also companies, foundations, so really more looking at private sector stakeholders that are part of not the membership, but more joining some of our different platforms of UICC. So in terms of our relationship to more United Nations agencies, This is primarily to support our global advocacy work as the only organization covering, the full spectrum of cancer control and also convening different types of organization. We really try our best to represent the voice of the cancer community at these different platforms with the United Nations. So I think we covered this. So I think it's really about, looking at, what are the different perspectives that we can bring to these global discussions. The role of GCCA, as well as the other coalitions that represent different cancer diseases, is also quite important for us because collectively you represent all the different patient groups globally. So in this sense, it's really important that your community also participates in the various consultations, opportunities to feed into a statement, advocacy at national level, because it's really with this collective voice that we can then come better equipped in our different discussions that involve cancer control, but also NCDs in our advocacy work. I think we covered this already. One stakeholder that I did not mention are ministries of health as well. So some ministries of health are part of UICC membership, although not all. However, we do engage with them throughout our advocacy work because of our role here in Geneva, in Switzerland. We also work with different country missions to make sure that they are aware of the important topics and cancer asks that we have in the different discussions. And we really have this dual role, which is to support the cancer community made up of our membership through capacity building, providing platforms, resources, connections, but also to drive this global impact. So this is more on the policy and advocacy work, which we also address in our different platforms, in addition to working with the key stakeholders at global level. So here you have a view of how the membership has grown quite considerably in the past few years. At the moment, we're focusing more our efforts in engagement as well, although we do regularly have about 45 to 50 new members each year. So I did not specify, but we are also an organizational membership organization. So that means that we accept different organizations, not individuals. But this also means that, like GCCA, it's great to have an organizational and an institutional commitment to being part of our community. So here are all the different stakeholders that I briefly mentioned earlier that interact throughout UICC platforms. So here together with the members, the partners, and the different international organizations. I briefly mentioned the advocacy work. So this year is quite an important year for the community with the United Nations high-level meeting on non-communicable diseases coming up in September. To this end, we are, trying to bring the voice of our membership to the global asks for this event coming up in September. So on our online platforms, for example, we are sharing what are the priorities, what are the areas that we want the members to highlight when they're interacting with their national stakeholders. So this includes, of course, very important for us is the voice of our patient support groups. There are over 40% of our membership, so close to 400 organizations that are patient support groups, part of UICC. So the voice of the people with lived experience is really key to feeding into this process. Another key one that I wanted to highlight is the World Cancer Declaration. So this is document that has been part of UICC for many years, although it's a bit outdated. So we started a process last year to review the different targets of this declaration, and the goal of this declaration is to have a sort of a blueprint for the cancer community to refer to when they're working at national level, working with other peers, and that they can really link their work as a patient group, as a society, as a hospital with these overarching goals. And this in turn becomes a very important advocacy opportunity, I think, for all the community. I'll pause here and maybe move on to the next slide, and we can get back to advocacy if there are any questions later. So moving on to capacity building. So we spoke about this dual role of, supporting the community and driving global action. So I'll give you a bit of an overview of our capacity building portfolio. So the role of our capacity building work is really to foster an influential cancer community that have the skills, knowledge, and networks and resources to achieve effective prevention, cancer prevention and control. So it's about strengthening the organizational capacity, so functioning effectively as an organization, facilitating the exchange of knowledge, nurturing these communities that have can learn from other peers, and of course, a targeted funding and technical support to address key gaps and needs. So I think these are points where we connect a lot with what GCCA is doing, including with your Global Equity grant, whom I was pleased to see also quite a few of our members are benefiting, given that some of our members overlap, which is amazing. Voila, so here a bit of an overview of, how many organizations have benefited in the past 3 years, according to the different areas of work that we have. So these are both online and face-to-face opportunities that we offer throughout the year. And we bring in experts from not only the cancer community itself, because we have such a, really strong skills within the membership, but also other experts from, let's say, experts in fundraising or experts in leadership. So we try to bring these different individuals to help train the community. So I won't go into details because obviously UICC does a lot, as you can see. But our support to the community really ranges from, fellowships, grants, virtual dialogues, so meetings such as this one. We have a similar structure in terms of trying to bring the community together, scholarships to attend some of our key events, which I'll present shortly. I spoke about advocacy skills because this is really key. We do have, Cancer Advocates program where the goal is really to build the capacity of the community to be stronger advocates at national level. And we do that by, organizing online courses, disseminating resources, and we have this online community also, which I'll send the link to. I can do it during or after our call. So this is a community where we have various rooms for different topics because we are such a different audiences. It's such a diverse audience. We have specialized rooms depending on the interest of the different organization, whether it be advocacy, patient support, communications and awareness raising, cervical cancer. So looking at really different topics that we see are also cross-cutting and of interest for the different organizations that are part of the UICC community. Actually we have at the moment one course that is starting on women, cancer, and power. So if you do have interested individuals to join this short course, please let me know. I'll also share the link. Maybe I'll give you a summary to me or Jen that you can disseminate to your community. And yes, this is actually the community that I mentioned earlier. We launched it last year. We're already counting, I think, over 200 participants in the platform. So the idea is really here to exchange, connect, learn, and we are centralizing all of our online training and resources on this platform, UICC Connect. Yes, I wanted to jump very quickly, although I'm sure many of you are familiar on World Cancer Day, because we launched the first year of the 3-year campaign this year, and the theme could not be more relevant, I think, for your community. Karma shared before the great post that you did with the ministry, which is great. We are still collecting until now many events, many activities around the theme, which is united by unique on people-centered care. I think, we all have, given the diversity of the community, different awareness days that we also support. Actually, we're in discussion with Nicole and Jen on, for this awareness month of March, and featuring that within UICC communications channel. But similarly, we invite all of you to really mark the World Cancer Day as well, because that's the day where we bring, the media attention on cancer more broadly as well. So I think it's great to have both approaches. The more we do, the stronger we are also as a community. And this year, as I said, it's really about advocating for people-centered care, an approach that really looks at the person as a whole, not just a patient to be treated. I think what's at the heart of the campaign and what resonates with the community, not only the community, but really the general public, individuals, governments, schools, it's really that each experience is deeply personal. By putting the people at the center of the care, we also have the stories of the people that are affected by cancer, and then the conversation starts with the people. And I think this is really a strong approach that we can have for this campaign, and that can inspire all the different community members. And we've seen a lot of interest, particularly from the patient groups this year. So happy to discuss, how you can get involved in the next year's World Cancer Day. Many of the UICC members are already working on it, starting, let's say, September, October, in preparation for February. So I invite you to have a look at the website of World Cancer Day, which is separate to UICC, although it's managed by UICC. And there we've compiled really all the diversity of the very creative also campaigns of bringing locally what a global campaign is, and giving that local touch, as Karma very nicely also presented with the blue tie the campaign. We invite the membership to do the same with the materials that we make available. So I think we can move to the next slide. I think this is similar to what we mentioned. So in terms of events, so I mentioned we have these different platforms, face-to-face and online. So the online is ongoing throughout the year. We have different thematic areas, trainings, etc. We also run face-to-face events, including the World Cancer Congress and the World Cancer Leaders Summit. The World Cancer Congress takes place every 2 years. We just concluded one in Geneva in October. And it's really about bringing together this community in its diversity that I mentioned earlier. So we usually meet also with Andrew and your team as well as the other global coalitions to see, okay, what can we collaborate on, what can we share in terms of best practices, and who can we engage in our activities. So the Congress, the next Congress, which is not cannot see here, is actually happening in Asia Pacific region next in 2026 in Hong Kong. So we'll publish a bit more about the event towards the end of the year, in time for people to submit sessions. And here again, the theme around people-centered care, or the patient voice, is really embedded in the program. It's unlike many events that have a stronger medical focus, the Congress, UICC Congress, really includes the diversity of the community, including the patient voice as well. The summit here is a different event. It's a smaller one of about 300 participants. The Congress is 2,000 participants. So the summit is our high-level policy meeting. So more looking at the leadership level of different UICC organizations, in partnership also again with the World Health Organization. And here it's to talk about the next theme is Bridging Divides, Building Futures. We'll be launching the new World Cancer Declaration by then. So we are, engaging the whole community in the process, in the lead up to this important event. Yes, I think I mentioned already the key points here, but again, happy to share more information in writing. Any questions at this stage? Again, just to highlight really that your role as part of this network of GCCA is key. And there are many opportunities, where I think we can leverage the different platforms that both GCCA, UICC has to not only give visibility to some of the work you're doing. Again, in mind, Karma's amazing work with this recent grant on raising awareness. Those are typically the stories and case studies that are helpful for others to see in the community. So I strongly encourage you to get familiar with some of the opportunities, and I'm happy to answer any questions that you may have. Thank you.
Thank you so much, Muriel, for sharing and for being with us today. Does anybody have questions for Muriel at this point?
Muriel, I saw you had a QR code at the end. So if we have any members that are either on the live broadcast right now or watching later, for organizations that are not yet members of UICC, what's the best next step to take?
Well, I encourage you to reach out to me and my team, and we'd be happy to share more information about what it means to be part of UICC and what the different options are. Depending on which opportunity is of interest for you, we can also, coordinate with you, Nicole, and to me, if it's about participating to a specific course and your organization is not yet ready to become a UICC member immediately, we can definitely, coordinate with you, Nicole, if you would like to nominate a representative of GCCA to some of these trainings. We'd be happy to open those up if there's one coming up. So the next one that we just published actually today is the Women, Cancer and Power. It's a short course, and it's based on a recent publication from the Lancet Oncology, and I think that's a great one to join if you have some leaders in your organizations that would be interested. We also have at the moment 3 courses that are online that are more self-study courses. Because we're aware that many of the members are very busy, probably working 3 different roles oftentimes. So these 3 courses are self-guided, online, and that means you can follow them in your own time. And also, these are focusing more on learning about what the global advocacy initiatives are at the moment of the World Health Organization. So there's one on childhood cancer, the Global Childhood Cancer Initiative, the cervical cancer elimination strategy, as well as the Global Breast Cancer Initiative. So I'm aware it's not on a colorectal cancer. However, we do have sometimes some patient groups that cover not only one type of cancer, or some patient groups are also working with other coalitions or patient group associations in country. And in any case, what we try to promote is really, even though the existing global initiatives and the current global initiatives are on these specific cancers, we're actually leveraging these approaches to advocate, to raise awareness about cancer more broadly. So even though the current courses are on these three, there are also other courses that we run and resources that could be of interest to some of your members.
Thank you so much for sharing, Nicole. Do you want to say a few words before we
Sure.
close?
Yeah, I just wanted to say, first of all, thank you so much to our speakers, our member spotlight. So nice to see you live, Karma, and to hear directly about the work that you've been doing in Bhutan. It's really inspiring. And also thank you so much to our guest, Muriel, for joining and sharing about UICC. Global Colon Cancer Association is a very proud member of UICC, and we strive to one day be the UICC for colorectal cancer. So all of the work that you do, Muriel, with World Cancer Day, with your focus on health equity and ensuring that we're trying to make it a little bit more fair when it comes to preventing cancer or surviving cancer. We know that the disparities around the world right now are it's really a tragedy. And so we share in so many of the foundations about why we exist. So really appreciate you sharing, both of you. And then I'll just to give two brief updates. So Tumi did mention that we'll be at NCCN at the end of this month. We'll also be at Digestive Disease Week, which is in San Diego, and that is in the beginning of May. This is where many gastroenterologists from all over the world attend this meeting. Jen and I will be there. We'll have a booth and be engaging with the healthcare community. If you, anybody from your organization or any of the medical professionals that you interact with will be at Digestive Disease Week, please reach out and let us know. We'd love to meet them, connect, grab a coffee, and Jen can provide the number of our booth so that you can tell them to be sure to stop by. And the other update that I wanted to give is last month we shared with you that we had a poster presentation coming up at JESMO, which is the Japanese Society for Medical Oncology. And I'm happy to share that the poster presentation was a big success. We even had a few people waiting for us, to present the poster, and they were very eager. The poster presentation was about patient advocacy in Japan, and we can share the link to the blog post. It's really unique because much of the work we do throughout the world is about advocating for access. And Japan, the issue is not so much that around access to treatment. They do have fairly robust treatment options and coverage, unlike, unfortunately, much of the world. However, it's culturally, patient advocacy is very different and has been very limited. So looking at opportunities to better support the advocacy community that does exist. And we also held a patient advocacy event a week later, and the buzzword for the event was PPI, so public and patient involvement. And one of the biggest things we heard is that it means something different. If you ask 10 people about what PPI is, you'll get 10 different answers. So we kind of know where we're digging in next in Japan is to look at how to maximize the PPI opportunities and make sure that the patient voice is really making it into drug development, clinical trials, advocacy at all levels. So with that, I think we've come to an end at our time, exactly on the dot.
Yes. Thank you everyone for attending. See you next month.